recording. Here we go. I'm recording you. Thank you very much for having this conversation with me. I'm very proud to do this. Have you been interviewed for someone in Brazil?
Yes.
Yes. Do you remember the name of the people or the magazine or something?
I don't. I thought it was a news. One was, I think I've had two interviews in Brazil. I think one was with a newspaper and I think the other was with a magazine.
All right. Uh, I want to start a little bit with the vaccines that you've been reading about, the importance of vaccinations, anti-vaccine movement. Uh, I want to know how this anti-vaccine movement started. Do you have an idea? Can you pinpoint exactly how it started?
Well, I think it started with the first vaccine. The smallpox vaccine was developed by Edward Jenner in the late 1700s. There was violent opposition to that vaccine in the early 1800s. And the reason there was violent opposition was because the vaccine was mandated. I think that the opposition to vaccination is centered on mandates. People don't like to be told by the federal government that they need to get a vaccine. So that happened with the first vaccine, and I think that's true today. I think if you talk to the sort of the professional anti-vaccine people, like the National Vaccine Information Center or Moms Against Mercury or Safe Minds or Generation Rescue, I think they would all say they would stop their anti-vaccine efforts if you simply made vaccines optional.
All right, I understand. That's interesting. I didn't know about that. Uh, I wanted to question about in your book about vaccinations to parents. You written that vaccines that there has its risks. I don't know how exactly. For example, there's some complicated things like Guillain syndrome involving flu shot. How exactly is the risk for it?
Well, I think with Guillain-Barré and influenza vaccine, you can say with confidence that the swine flu vaccine that was given in 1976 had a risk of Guillain-Barré syndrome of roughly 1 per 100,000 people who were given the vaccine, about 1 per 100,000.
Mm-hmm.
It's not clear that vaccines since then, influenza vaccines or frankly any vaccine, causes Guillain-Barré syndrome. But the limit of detection is 1 per 1,000,000. So usually when the Centers for Disease Control and Prevention or other groups try and characterize this, they always say, we can't say that it's any more common than 1 per 1,000,000. And so that's what people are left with. They're left with this vague notion that vaccines might cause Guillain-Barré syndrome when they're, at least since the 1976 swine flu vaccine, there's not clear evidence that it has.
I understand. Uh, there's some in your book you said that the people sometimes doesn't understand about it. That if a vaccine causes some problems, it's usually that disease that vaccines try to prevent causes the same problems, and it's even more riskier. Can you elaborate a little on that?
Sure. So probably the best example would be something called thrombocytopenia, which is a lowering of the
Low
platelet
platelets.
count.
Yeah.
Right. So measles vaccine can cause thrombocytopenia. It does. It causes it. There's been a couple studies, all have been consistent and reproducible, which is that measles vaccine causes thrombocytopenia in roughly 1 per 25,000 to 1 to 30,000 recipients. Measles virus also does that, far more common. So that's generally true. I mean, when you get a chickenpox vaccine, you can get a mild chickenpox rash 8 to 12 days after getting that vaccine, which will consist of usually fewer than 5 blisters. Sometimes it can be as many as 30 blisters. But if you have chickenpox natural infection, you could get 300 to 500 blisters.
All right.
So yes, that's true.
All right. And I think from Brazil, the perspective about this pseudoscientific claims is a little bit different, I guess. People here that are being asked, they know about the link of MMR vaccine and autism. If you mention others that they don't know about it. My question to you is this: knowing that the link between autism and vaccination is false, how do you think it's dangerous to widespread information that is not corroborated by science?
Well, I wish I had the answer to that. I think once you scare people, it's hard to unscare them. Once you open Pandora's box, it's hard to close it. And when that question was raised by Andrew Wakefield in 1998 with his publication in The Lancet, That wasn't a study. That was simply a case series of 8 children who had received the vaccine and had developed signs and symptoms of autism within 1 month. That's not a study. Nothing was studied. It was just a case series. Subsequently, it was studied. And so there have been now 12 studies looking at large numbers of people who either did or didn't get that vaccine to answer the question, are you at greater risk of having autism if you receive that vaccine? And the answer has been very reproducible. No. But how do you convince people? You know, on the one hand, I just think people are far more compelled by anecdote than they are by statistics. So if Jenny McCarthy gets on Oprah and says, I watched my son get this vaccine, I watched the soul leave his eyes, and she cries, that's very compelling. And if you get a scientist on the show that says, okay, fair enough, fair question, could the vaccine have caused autism? Got the vaccine, you were fine? Your child got the vaccine, now has symptoms of autism. Is this cause and effect relationship? Is this just a temporal effect or is it a causal effect? You can answer that question. It's a scientific question. It can be answered in a scientific venue, and it has been answered in a scientific venue. But then how do you compel people with the science? And how do you trump the anecdote with science? That's the hard part. And the media becomes critical in that, and they're not great at it.
They're not great at it. I was going to mention to you that if United States people believe that there is a need for scientific speaking, scientific disclosure, in Brazil I think we need more because we don't have. You gave an interview recently for an organization that speaks for science, Skeptical Inquirer. There's other ones like that in the United States. In Brazil, I haven't heard any of them. So here in Brazil, it's even scientists over here. They don't do too much scientific speaking, so we need it more. That's what I'm exactly trying to do. Try to do this interview, talking, posting my blog, even not only posting of myself. I'm translating some articles. So that's I think that's a different thing that you have in Brazil, United States. In the United States, these people are very strong to support for science. So. And you've written a new book, Do You Believe in Magic for Alternative Medicine, covering the whole aspects of alternative medicine. In the beginning, you mentioned that even doctors that are non-alternatives, the line between alternative therapies is very fuzzy. And I'm very impressed that you mentioned about the PSA neurologists. And there are several reports mentioning that prostate people die with the prostate cancer, not the prostate cancer. But if you talk about neurologists of that, my question is, how can you make even the urologists that not no alternatives? Where are we missing it? Why are we getting wrong? Why do we know about this and these people are not knowing about this? How can we make a different changes in information to these people know the truth?
When you say know the truth about meaning about the urological story, the PSAs and biopsies, is that what you mean?
Yeah, that's what I mean about the PSA. Urologists, like they see a prostate cancer, they want to remove it, the prostate, and does not put the risks and benefits of the surgery. The surgery has its complications. Urinary incontinence is one of them, and like the fact if the people will die from other things than the cancer from the prostate, we have to actually question, well, why we're going to take it out.
Yeah, I ended up switching urologists because the urologist that I was seeing just continued to buy into the notion that he wanted to get repeated PSA levels and repeated biopsies. And there is a morbidity associated with that. And I guess my thinking eventually was to find a urologist who I thought practiced medicine that was consistent with the evidence. Yeah. The evidence being that PSAs and these biopsies haven't lengthened the lifespan of an American male. And so just a lot of biopsies and PSA, it means a lot of money for the urologist. I mean, they're living off of this. And it was nice to be able to find a urologist who was willing to practice medicine based on what was the evidence. I don't know if you just saw the recent New England Journal of Medicine article, but it looked at people who took finasteride, which is Avodart, and compared them to people who didn't take Avodart. And what they found was that there was a lower incidence in people that took Avodart of having prostate cancers that were unlikely to kill you. So basically they said the only real reason to take Avodart would be to to avoid getting all these PSA levels and
All
avoid
right.
getting all of these biopsies. I mean, that's not a great reason to take a
Uh,
medicine. Here's another way to do it. Just don't get the biopsies and don't get the PSA levels.
Can you say that again about the you comparing Avodart, people that took Avodart? You said that there's no reason Avodart do not lower the incidence of prostate cancer.
No, no, not the bad kind of cancer, not the kind of cancer that would kill you. No,
All right.
it didn't. And so, but so the only reason that when this, you should take a look. This article just came out in the last couple weeks in New England Journal of Medicine. But their conclusion was that the drug, what the drug did was it lowered your risk of the kind of prostate cancer that doesn't kill you, the kind of prostate cancer that causes, you know, high PSA levels, the so-called prostatic intraepithelial neoplasia type 1 and 2. That's not going to kill you. It's when you get to the third stage that it's a problem. And so because the urologist will frequently pursue the so-called PIN2 diagnosis with continued PSAs and continued biopsies, this avoided that. This could or lessen your risk of having to go through that, if that makes sense. But in any case, it's a flawed system. For all the PSAs that are done, for all the biopsies that are done, it hasn't lengthened the lifespan of the American male. But it's a big money maker for urologists. So I think they're slow to give it up.
Yeah, I have used Avodart, but not for prostate, for hearing loss. It's not technically approved even by FDA, but I use it for some very specific interval of time. Finasteride is even more common, but even finasteride, there's some evidence to that lower the incidence of cancer in the prostate, because people took finasteride for prostate hyperplasia, benign prostate hyperplasia.
Right.
There isn't any evidence that lower the risk of cancer.
No, it helps shrink your prostate. I mean, it does help shrink your, those data are clear. So that it is a value for benign prostatic hypertrophy. Yes, that's true. But it also seems to lower the risk of a cancer that's not going to kill you, of a cancer that you're going to die with, not from.
Not from. Yeah, thank you. About your book again, what's your opinion about medical students have been taught in medical school things that are not scientific?
I think it's criminal. I think it's unconscionable. I tell you, I got an email from a student who was a third-year medical student at New York State University in Valhalla, New York. And he said to me he had just had a lecture from a homeopath who explained that water can remember where it's been, okay, can remember that, you know, there was an active substance there at some point in the past. Nonsense, utter nonsense. So he wrote a letter to the dean of his medical school saying he was offended that this man had come to teach him at his medical school, a medical school that in theory should be evidence-based and not mystical. And the dean wrote him back that he needed to be more open-minded. Very painful. I mean, this has nothing to do with being open-minded. It's all about evidence. Science isn't about being open-minded. It's about forming a hypothesis, establish burdens of proof, subject those proofs to statistical analysis. That's what this is about. It has nothing to do with politics. It has nothing to do with being open-minded. And so I'd like to think that the dean of New York's medical school would know that, but he didn't.
So some people even would say that the people that is failing to be open-minded is the dean of medicine, because he's not willing to accept the homeopath does not work.
Well, you know, and maybe sometimes it does work. I mean, maybe sometimes you take something that you think is going to benefit you, and it does benefit you simply because you think it's true. And now,
it's placebo effect.
But the placebo effect is not trivial. I mean, I think that's a real effect, and it can be physiologically based. You know, people can, as I talk about in the last chapter of my book, I think people can learn to release their own endorphins, can learn to upregulate and downregulate their immune system. My daughter is one of them. I mean, my daughter, I can tell you this story. She's 18 years old. Last year she was a senior in high school, and she raced crew. She was a crew. She was very good. She was a very good crew racer. But she sometimes would get tingling in her fingers because I think she just forgot to breathe, or she was too nervous and forgot to remember to breathe. So she went to the GNC Center, you know, this like a pharmacy, and she bought something called a Himalayan sea salt puffer. Okay, so it's salt that's obtained from the Himalayan mountains, and you put it in this plastic canister, and the plastic canister has holes in the top, and you breathe in salt air. So she was excited because she thought that this would help her dilate her bronchioles. She thought she had exercise-induced asthma, which she doesn't have. So she
Uh-huh.
wanted a real bronchodilator, which she wasn't going to get. So she went and she bought this. And she breathed it in, and then when she raced, she felt a lot better, probably because she just calmed down and remembered to breathe. That's good. So that's all good. It has nothing to do with the sea salt. And at one point, actually, I said to her when she was filling up the canister, I said, "Honey, do you really think that the salt from the Himalayas is any different than the salt in that salt shaker over there?" And she said to me, "Would you let me believe in something, damn it?"
Yeah, I have this kind of problem a lot. People usually do not like us to be too much skeptical. They say it's not good. They believe a priori that it's not a good thing to be too much skeptical. A person do have problems with that too.
Yeah, I think that's true. So believe in it. I mean, when I saw, and I talk about this a little bit in the book, but not thoroughly. When I had surgery on my left knee, my surgeon in the recuperative period that I take chondroitin sulfate and glucosamine. Now, if you look at the data, chondroitin sulfate and glucosamine do nothing to promote healing. They do nothing to decrease inflammation, pain, nothing. And there's been studies done showing that they do nothing for the pain of arthritis. Well, I knew those studies. I mean, I'd read those studies. And so when he made that recommendation, essentially, I think because I wanted him to like me, I took it a couple times, but then stopped. I just couldn't convince myself that this is something I should do. Now, you could argue if I thought this is going to be great, this is going to relieve my pain, and therefore I wouldn't take a non-steroidal anti-inflammatory, or I wouldn't take a COX-2 inhibitor, then it's a value, because it's certainly not going to hurt me. It's a little expensive, but it's not going to hurt me. So you could argue there's something to be said for that. But again, I didn't share that belief system. In theory, science shouldn't be a belief system. It's an evidence-based system, and the evidence wasn't there for this. But you could argue that there's something to be said for a belief system in this. You can make that argument, the so-called mind-body connection.
I want to question about it, that how the alternative medicine that it's medicine that usually works, that you know that it works. Can you give some examples? I want to discuss a little bit of.
Sure. I mean, if you look, for example, there's an ancient Chinese remedy, which is to chew on the artemisia plant to treat malaria. So now we know that actually there is an active substance in that artemisia plant, which we now call artemisinin, that has anti-malarial activity. So that was a medicine. I mean, when people used to chew on the plant foxglove, which contained digitalis, now we know that its digitalis was there. We can synthesize drugs like dioxin, and like digoxin. And so one century's alternative medicine, if you will, can become the next century's mainstream medicine. But that's all studyable. That's all understandable. You know what I'm saying? We don't have to look to the gods to explain why certain things work. And when things don't work, then we have to accept the fact that they don't work. And so there's no such thing as alternative medicine. If an alternative medicine works, then it's medicine. And if an alternative medicine doesn't work, then it's not an alternative.
I think that it's the Dr. Edgar Ernst, the first professor of complementary alternative medicine. He mentioned that some treatments that has been proven to work for him, but the conventional doctors does not use it. And he gave an example in an interview of a magazine in Brazil, that some joints work for depression. So in his mind, some joints works for depression, equally to placebo, equally to antidepressant, and but doctors don't use it. So he said that the label, alternative medicine label, is a okay fit for this kind of case.
Well, I agree with him to a point. I mean, if you look at there's a number of studies now that compare St. John's wort to placebo for mild or moderate depression. And you can argue that the weight of the evidence supports the use of St. John's wort. It certainly doesn't for severe depression. I mean, for severe depression, St. John's wort doesn't work better than placebo. So I think I agree with him. The problem with this industry, at least in the United States, I'm sure it's also true in Brazil, is that what is St. John's wort? Because it's an unregulated industry, it's very hard to compare one study to the next, because there's no assurance that what's contained in that product is in any way similar to the other product. I mean, for example, when someone comes into our hospital with malaria, we don't give them cinchona bark to chew on as a source of quinine. We give them quinine from a company that's regulated by the FDA, so we know exactly how much they're getting. I mean, I think if a psychiatrist in our hospital said to us, we want to put St. John's wort in our formulary because we think that there are data to show that it works in mild to moderate depression, we would have trouble with that because we wouldn't know that what was in the product was on the label is actually what's in the product. And that has historically been true in the United States. The label is an inaccurate reflection of what's going on in that dietary supplement. It just needs to be a regulated industry. If St. John's wort works to treat depression, I think that a company should make it and be regulated by the FDA so we know what we're giving to patients.
Mm-hmm. But I didn't hear correctly. You said that it's better than placebo. It's equal than placebo in some cases.
No, I think St. John's wort for mild depression is better than
depression, right? And the other question is that I've been reading that some people claim that even the SSRI, selective serotonin inhibitors, is not better for placebos to treat depression in some cases. There have been studies, the publication bias. Do you have any no?
I agree with that. I think that there, as a general rule, the companies are under little pressure to publish negative data, which is unfortunate. So the data that you tend to see tends to be selected for those studies in which there is a difference, even when if it's just a marginal difference. So I think that you're right. I think pharmaceutical companies don't help us there. And I think there's a lot of frustration with conventional medicine and with pharmaceutical companies that is deserved. I think the point of view I try to make in this book is that one should bring the same level of skepticism to alternative medicine that one has for conventional medicine. Don't give alternative medicine a free pass just because conventional medicine is flawed.
Mm-hmm. Yeah, I would say that I try to make sometimes a difference between the science that you use in conventional medicine and sometimes the service of medicine, because the service of medicine can be painful for different reasons. People can wait several hours in emergency room to be seen by a physician, but there's nothing problem with the scientific evidence. And what we really on it, it's that all doctors to be able to look the data and practice medicine by evidence and not, I mean, for mysticism, like you claim in your book, which is I love the quotation. I make I make a question to you in email about vitamin E. You mentioned a book that is dangerous for heart disease and something. Do you be aware that some hepatologists recommend this for treating non-alcoholic steatohepatitis?
I'm not familiar with those data. I mean, if there are clearly studies showing that vitamin E in that situation is a value, that's great. I don't know those data, but if those data are there, that's great. But I think what amazes me about the vitamin E story, I mean, I gave a talk recently where I walked into before I gave the talk, I walked into something called a general nutrition center, which is just one of these big health stores in the United States. And I bought a preparation of vitamin E that said natural E1000 is what it said on the front. And if you looked on the back label, it said that it had 33,333% of the recommended daily allowance. So it had no, I'm sorry, 3,333% of the recommended daily allowance. So it had 33 times the recommended daily allowance. Now, if you took this sort of brown-colored gel cap out, it was about half the size of an almond. Now, almonds are an excellent source of vitamin E. You would have to eat about 1,650 almonds to get what was the amount of vitamin E that was in that one gel cap. That's not a natural thing to do. That's why I don't understand why they put the word natural in the label. And I think people never see it that way. They think this is all natural. This is just an untouchable halo that this preparation should live under. When taking large quantities of supplemental concentrated anything, I think should be viewed with suspicion. And now we know if you take large quantities of vitamin E and vitamin A or beta carotene for a fairly prolonged period of time, you increase your risk of cancer, you increase your risk of heart disease, and you potentially shorten your life. Those data are clear. There are 20 studies plus that show that. And I think that if this were a regulated industry, I really think there would be a black box warning on these products instead of what you do see, which what you do see is it says the Food and Drug Administration has not approved this product for the diagnosis, treatment, or prevention of any disease. That's what it says on the back.
I here in Brazil, there are some vitamin supplements that in the label has this disclaimer: this product does not have evidence to support it is used for treat or prevent any disease. At least I think people bought it, but people buy it. But I think it's less dangerous. The label that there is a disclaimer over there, and so I want to make a question about what about not taking too much dose of vitamins, just the central or something, a multivitamin, not mega vitamins, just a little bit of vitamin. That is dangerous on it?
There's one study that was done in Iowa, the Women's Health Initiative study, that showed that women who took these multivitamins, which is to say supplements that contain at or about the recommended daily allowance, actually did worse than people who didn't take multivitamins. Now, I would like to see that study repeated before one can say that with any sort of confidence. But I do think that people have this. Here's the danger of doing this. I think what people say is they think, all right, you know, my diet is not perfect. I mean, I don't really pay much attention to it. Maybe I'm not eating many fruits and vegetables. Maybe I'm not getting the vitamins I need. So just to make sure, I'll take this multivitamin. Now, I think the false assumption there is that the vitamins that are contained in that are going to be processed and presented in the same way when they're taken as a small pill than when you eat a vegetable or eat a fruit. I think you're far better served, and frankly, it would be cheaper if you just spend time thinking about your diet and trying to get it that way, rather than just leaning on this pill that you're going to take and assuming that everything's fine.
Yeah. What I think about it that you mentioned about the natural, people saying that is natural. I think that is a little bit preconceived because people say a product is natural and there is no harm. I think there is a little bit preconceived. How this confidence came from? I never know. I never understand how this confidence came from. People try to answer the question before even start to question it. It's a little bit preconceived. If you agree with me on that.
Yeah, I give credit to the industry. I mean, the industry has been able to sell themselves as natural. I mean, so you have on one hand, you have like big, bad pharmaceutical industry, which makes synthetic products, and they're just trying to make money and they don't care. And then you have this other industry, the nutraceutical industry, if you will, the dietary supplement industry, that sells themselves as it's all natural, it can't hurt you, it's like it's being made by elves and old hippies on, you know, on mountainsides, you know, where there's flowered meadows. I mean, that's not true. First of all, Pfizer and Huffman LaRoche are major players in the dietary supplement game. Those are big pharmaceutical companies, so they're involved on this side as well. And secondly, it's basically an unregulated industry under no obligation to support its claims or admit its harms. And they've been able to, in the United States, have enough political influence to be able to keep the FDA from regulating them. But that will change, because there have been so many problems with these products recently. I can't imagine that eventually consumers won't stand up and say, we're getting screwed here and we need to know what we're buying.
Yeah, interesting. A question that people sometimes, I think you mentioned that in your book or interview or something, that people believe there is a controversy in the science in some points, but there is no controversy. We know the data very clearly, and why people keep this idea that there is a controversy, even if you do our best to say that there's no controversy. This happens even more history, evolution, and creationism in some sense in science. But in medicine, this can threat people's lives, so that they can kill themselves without knowing it. I got very impressed with the picture of Katy Perry putting the mega vitamins, too much pills on that.
I mean, you know, because in this case, I think the industry is able to. Well, let me take a step back. If you answer the question, how many studies are published a day in scientific and medical journals in the world's literature, the answer is 4,000. There's 4,000 studies published every day in medical and scientific journals. And not surprisingly, they follow a bell-shaped curve. Some of them are excellent, some of them are awful, and most of them are more or less mediocre. Which is to say, you can find a study that proves anything, right? That proves any sort of hypothesis we have. Now, it'll be a lousy study, but that doesn't matter. So if you look, for example, in the 1950s, when there were the first two studies came out showing that cigarette smoking was associated with lung cancer, those data couldn't have been clearer. There were two excellent studies. They were published in great journals. But the industry said, this is controversial. because here's studies that have been done in mice that were terribly done and not relevant to humans that show that cigarette smoking isn't harmful. And here's my friend Bob, who lived to age 90 and he smoked every day and he's fine. So it was always presented as a controversy until it just couldn't be claimed to be a controversy anymore because there was so much data. I mean, the same thing was true with cold fusion. When cold fusion was first brought up in the 1980s, I mean, this was controversial until it was just impossible to call it controversial anymore. And I think this will be true with these megavitamins, I mean, these large doses of vitamins. I have to believe at some point the Food and Drug Administration is going to stand up and say, there is harm that's being created here, and we can't ignore it anymore. Because we're at 20 studies now that have shown this, 20.
About other types of alternative therapies like acupuncture, do you think that is its value for something, for some condition?
Well, if you look at Edward Ernst's work, which I think was brilliant when he was at the University of Exeter in England, he's the first one who did those retractable needle studies to show that it worked. If you thought that the needle was going under your skin, that was as valuable as the needle actually going under your skin. Mm-hmm. Well, that's great. If that's true, and certainly there are studies, and they're not great studies, but there are studies showing that some people can learn to release their own endorphins in this sort of acupressure situation. So that's great. You know, I can tell you there are 2 pediatricians at our hospital now, at Children's Hospital Philadelphia, who have been quote unquote trained in acupuncture. Who it's like being trained to be a psychic, as far as I'm concerned, but who now want to, bring acupuncture into our hospital. I can tell you this right now: it's not going to happen. We're not going to let this happen. And why do they want to do it? They want to do it because I think there's patient demand. And so what's happened is, instead of being what we should be doing as doctors, which is to help patients through this dense thicket of medical information. Instead of doing that, instead of setting a professional standard, we've become waiters in a hospital. You know, here's a marketplace, so we'll offer this. And the hospital next door to ours, the hospital of the University of Pennsylvania, which is part of the University of Pennsylvania Medical School, they offer a Reiki master to help manipulate your healing energies in their oncology clinic. Now, I don't think that hurts anybody, and maybe some people do benefit from that. But the slippery slope is that it creates this notion that there are healing energies to manipulate. So it's just a little scary.
I think there's some point, people need to make the clear distinction between if your treatment works for some condition, that doesn't mean that it works in the way it proposes, the way it claims. For example, if actually it's good for some pain or something, doesn't mean that you have key meridians or like they say, the flow imbalance in energy in 3 or something.
No, you're right. That's a very good point. You know, there's a point. Mehmet Oz, who I talk about in the book at the beginning of the book, is very popular in the United States. He has a television show that 4 million people watch every year. He was asked the question, what do you do when your children are sick? He said, when my children are sick, my wife gives them homeopathic arnica. And if they're still sick, if they don't get better from that, then she calls me. Well, here's the logic of that. Probably 80% of the diseases we see in the emergency department at Children's Hospital of Philadelphia are self-limited, right? They go away on their own. Viral infections of the nose or throat. And so from his standpoint, you make the argument, I'm going to give them homeopathic arnica, it's not going to hurt them. The odds are they have a self-limited disease. By giving them homeopathic arnica, that means they're not getting an antibiotic for their viral infection, and that's good. It means that they're not getting a cough and cold preparation, which contains pseudoephedrine that can be quite damaging, especially to young children, and that's good. The problem is, and they'll get better. The problem is that either he or his wife believe that the homeopathic arnica actually made them better. Now, if that's true, then you take that next possibly awful step, which is that a child has asthma, and you give them a homeopathic bronchodilator. Now, this has happened where children have gotten a homeopathic bronchodilator and died instead of getting a real bronchodilator, which would have saved their life. That's happened. So that's the problem with using the homeopathic arnica. Although you could argue that it has some value, it creates this false notion that it was the homeopathic remedy that made you better and not just time.
I think that's really the problem, is creating the false notion. I think that's my problem with this alternative therapy, is that we're telling lies. These people are telling lies. We know that they're wrong, and often I've been called to be very skeptical. Oh, you're too much skeptical. You have to accept something, but I accept the evidence. I accept the data. And I think that's very, very better to do it, especially for our health.
Yes, agreed.
You said about pseudoephedrine is dangerous for kids. Can you elaborate on that? I didn't know about that.
Yeah, no, so this Drug Administration a number of years ago actually issued a warning for the use of pseudoephedrine in young children, especially those less than 2 years of age, because it had been shown to cause hallucinations, psychosis, and even death. So it's a powerful medicine, and it also doesn't make your cold get better. So, I mean, there really was no reason to use it.
Right. What's the whole point of writing your book? This new book about Do You Believe in Magic?
I guess I have this fanciful notion that if you can explain something clearly and compellingly in an interesting manner, that you can get people to take a step back and think about what they're doing. That's all I ask. I ask people to be just a little more skeptical about what they're putting into their body. You know, I think you should be skeptical about anything you put into your body, including vaccines. I think there should be data that show that vaccines are what they're claimed to be, safe and effective as they're claimed to be. That should also be true of this. When you give your child 1,000 milligrams of vitamin C, the child would have to eat probably 14 oranges or 8 cantaloupes to get that same amount of vitamin C. That's not a natural thing to do. And therein danger lies. I just am trying to send out sort of a little warning shot that you need to be a little careful about this, that you shouldn't put this industry under this untouchable halo as if it can only be good and can never hurt you, that there is such a thing as too much of a good thing. I just want people to think about what they're doing. That's all. I try to be fair in that I think the placebo response is of value and shouldn't be dismissed. And I think alternative therapists are much more willing to spend time eliciting that than the conventional therapist is. And there is some value there, but I just have this notion, and I'm sure it's a wrong one, that that if people sort of hear data presented in a compelling, fun, interesting way with stories, that it will be convincing. So
Yeah.
I don't know. I mean, well, the book is actually selling fairly well, so maybe some people are being influenced.
Do you know if it's going to be available in Brazil?
I don't, there was just a request that the book be translated into Korean, so it's now going to be available in Korea. What I would say is, not to my knowledge, I mean, if you know of any publisher that would be interested in publishing this, I'd be happy to do it. I mean, it wouldn't cost virtually any money. I mean, all the money I make on this book goes to charity, but usually for $1,000, $1,500, they can buy the rights to the book and translate it into Portuguese, which would be fine.
How much is the license? I'm sorry.
Say it again.
You said that the publisher in Brazil had to buy the license for translating.
That's right. They would have to license it from HarperCollins, but it's really very inexpensive.
You said the price?
It's probably $1,000.
All right, $1,000, just $1,000.
Yeah, that's it.
Right. It's because in the past I offered myself to translate a book, a Richard Dawkins book, and the publisher over here in Brazil didn't even answer my mail. Because that's a really problem here in Brazil. Because even some people that actually wanted to read it, they don't read English very well. And if, for example, in my blog, some writing a post or a book takes a lot of time. And I'm a PhD student, and I work and I have to write some posts. And I thought that if I could just translate some articles, some internet articles, it would be very, very faster. So, for example, I would be willing to translate your book. The book for Ed Ernst, I think it's 5 years old book and just been published in Brazil this year. So I think it's a long time, it's a long delay, and that's the reason I wanted to get these things that keep moving a little bit faster than
Well, here's what I would say. If you can identify a publisher, just email. You have my email address. Email me the publisher, and I'll send it on to my agent, and she'll get in contact with the publisher, and we can get it done. I think it'd be fine. Happy to do it.
I'm gonna try to send us some emails of it that I'm in contact with you, that you wanted to publish a book, and from you, be very honored. Even if I don't do the translation myself, I would like to do it, but I think it's a way to help, a way of helping scientific speech. I think it's a way of doing a little bit contribution on that.
Okay.
I have one, I think it's a polemic question for you, is that on your book you mentioned about supernatural explanations that you use to explain diseases, and today we replace them and do use natural explanation. On your opinion, do you think that religion or any natural, supernatural idea is difficult to create some sort of barrier to scientific understanding?
Yes, obviously. I mean, that would be the ultimate belief system. I mean, I think when I wrote this book, Do You Believe in Magic? I got a lot of hate mail from people who I think were angry that I had attacked their belief system. I'd attacked the church of vitamins and supplements. I mean, obviously, um, I'm actually interested. The next book I'm working on actually has to do with that. It's the tentative subtitle is The Clash Between Modern Medicine and Religious Belief, but probably more accurately, religious zealotry. Those people who are the faith healers, Jehovah's Witnesses, some of these unusual practices by the Church of Scientology. So I'm taking that on in the next book. But sure, I mean, see the difference. Religion is a belief system. Science is an evidence-based system. So there really is no overlap. But I think, obviously we deal with that with overlap all the time because people sort of take what should be evidence-based systems and make them belief systems.
Do you a religious person?
Am I a religious person?
Yeah.
No.
No? All right. No, not even. I'm atheist. I'm totally atheist. Uh, and I'm not sure if I covered this. Why people distrust modern medicine? Why they don't even get a credit on it?
Because I think it can be frustrating and distancing and technological and cold. I think what alternative medicine offers is something that's warmer, that's imbued with a sort of spirituality. And I think people like the surety of alternative medicine. You have people like Mehmet Oz and Deepak Chopra and Andrew Weil, who serve really as gurus. They're all knowing. There was an article actually by Michael Spector in the New Yorker magazine talking about Mehmet Oz and him walking into the studio where he's about to do his show, and people just want to touch the hem of his coat. I mean, to use the New Testament analogy, it's just he's a guru. I'll give you another example. In the TV show Star Trek, the doctor was Bones McCoy, right? And in order to make a diagnosis, he had a scanner, and he would take the scanner and he would go up and down, and then he would look at the scanner, and that would be the diagnosis. That was absolutely certain. There was no doubt about it at all. And I think the fact of the matter is that modern medicine is uncertain. I mean, there's many things that you don't know. I'm sure we'll know much more 100 years from now than we know now. We're constantly generating new information. That's what science is. I mean, in science, as you generate new information, you can take a textbook and throw it over your shoulder without a backward glance. That's good. It's mutable. It's changeable. I mean, it's always self-correcting. But I think to some people that is seen as that uncertainty is disconcerting. Whereas that you get the certainty of Andrew Weil. If you look in his books, he tells you not only how to treat your hepatitis cava, but he tells you how to be a friend. He tells you how to make your low-fat salad dressing. I mean, how to raise your children. It's like a Bible, really. I mean, and so I think people are drawn to that, the spirituality of that.
Very good response. I think it's very easy to sell alternative therapy. For example, everyone gets a boost in the immune system. What exactly would be if you want to make a drug that boosts my immune system, that improves my immune system, what the drug needs to do in my immune system exactly?
I mean, I think there is a clear correlation between nutrition and immunity. I mean, so if you eat well, then you keep your immune system in good shape. The notion that you need to supplement your diet, with these large quantities of concentrated vitamins or supplements, I think is just false. And then obviously you can get specific. So if you're just talking about boosting general immunity, then eat well. If you're talking about boosting specific immunity, get vaccinated.
Yeah. I would like to thank you very much for your time, for your patience, and I'm very happy to be talking, very honored to be able to talk with you, and hopefully we're going to be able to put your book here. You said about your next book, what's the title?
The tentative title is Sacrifices at the Altar, the Clash Between Modern Medicine and Religious Belief.
Oh, that's really interesting. Do you plan when it's going to be available? Do you have
I haven't tried to get a publisher yet. Well, I'll try in the next few months to get a publisher.
But that's you just finished it.
I don't do it the right way. The way you should do it is you should write a proposal, then you should get a publisher, then you should write your book. What I do is I write the book, then I write a proposal, then I try to get a publisher.
All right. I mean, if you get a publisher, the book is just ready. It's just you're gonna be publishing in a little. We gotta make this. Yes. Thank you very much.
All right. Thank you, Philippe.
Thank you.
Take care.
Take care, you too.